Good morning, everyone, and welcome to today's SADA webinar designed to educate and inform members of the public. We are delighted today to have with us Dr. Ridwan Hafaji, who will be sharing his expertise on the what, how, and the why of dental implants. Dr. Hafaji is a prosthodontist in private practice in Cape Town, and he also serves as a sessional consultant at the University of the Western Cape. Dr. Hafaji, it is a pleasure to have you with us this morning. Thank you so much for joining us.
Well, thank you for having me. It's always a privilege to be having the SADA banner on my right shoulder. That's the one. There we go. Okay, so we're obviously here to chat dental implants. I think the first thing we're probably going to take it back a little bit is just the replacement of missing teeth. And why do we need to replace teeth? And I think it's fairly obvious from the functional and the aesthetic purposes of why those teeth are important to be replaced. Not all teeth need to be replaced. And I think classically we think of wisdom teeth or the third molars. Some patients have those third molars that are perfectly erupted, they're in the right place, there's enough space in the arch. And if they lose that tooth for whatever reason, tooth decay doesn't have to be replaced. Functionally, doesn't serve much purpose. But as we move more anterior or mesially into the arch, those teeth or the replacement of those teeth become more critically important. And I think I always think back, I was 1 year post-ComServe and I had a patient back then and he was a 27-year-old guy, 27-year-old young professional, just qualified. And he had this choice between a root canal and an implant for tooth number 26, upper first molar. And were all factors considered, that tooth needed to be extracted. And he promised he would never lose a tooth in his life. And this was the first tooth. And for whatever reason, we extracted the tooth and the plan was to do an implant and he never got an implant or he never chose to go for an implant. And I met this patient easy 10 years later. And when I saw him 10 years later, I realized that he had lost 3 more teeth in the process.
Wow.
For various reasons. And you start thinking the first tooth he did not want to lose, but he had to on a dental background. And then he almost became desensitized to tooth loss.
True.
And suddenly he lost 3 more. And I think at that age, now he was probably sitting in the region of about 35, 36 years old. And now he was sitting and thinking, you know what, I lost the one tooth. Yeah, the dentist said I should get an implant, but I've been functioning fine. And maybe I don't need that implant. Maybe they were trying to make money. Maybe he was trying to try something new on me, whatever the reasons were, but he didn't see value in it. 10 years later, now he's got 4 separate gaps in his mouth. And suddenly now he returns saying, I think I need this implant. So I think it's something that you also have to trust your oral healthcare practitioner when the recommendation comes for the replacement of a tooth, because with experience and what we've learned, we know that there will be consequences. I think even if we take away the functional or the oral health consequences of it, I read a paper recently, and it's this buzzword that comes around in dentistry and disappears every so often and returns: neuroplasticity. And this came up, and where they looked at a group of patients that had so-called a fixed set of teeth in their mouth, and patients that were wearing normal dentures. The normal dentures you put in a little glass at night. And the cognitive abilities and strengths of those patients beyond the age of 60 were stronger in those that had a functioning dental system.
Wow.
So it's not just the functioning and the nutritional abilities and the social abilities. It's also just your higher brain order that requires teeth to function for that area of the brain to be stimulated. So long term, I think it can be forgiven. 50, 100 years back, technology didn't allow us, and we just had a certain aging process.
Yeah.
Now, when we look at patients' life expectancies, and 60 is no longer old, 70, 80, we see more and more patients presenting in our practice who are 80 plus. And it's just because of the access and the technology with healthcare that allows them to live longer. But the cognitive ability needs to also be present, and the social ability needs to be present. And this is where this whole thing comes together. And then on the other extreme, we have patients who would be in a position where they're about to lose a tooth and the dental implant becomes one that's recommended. And they want it and they'd be happy to invest into that implant. But you also sometimes have to slow things down and say we have to look at what else is happening in the mouth. We also
Mm.
don't want patients to over-invest into a dental implant, and we'll chat more about that now, when we haven't had our baselines of dental caries, gum disease, failing restorations, or fillings that need to be replaced, because fillings don't last forever. And you'd rather invest in consolidating what's there before we
Mm.
go into investing, or you could end up in a situation of over investing in an implant when your baseline teeth aren't in the right place.
Yes.
So what is an implant? An implant is basically a titanium post that is used to support a tooth. Um, and the surgeons will not take kindly to this, but it is just that. It's a titanium post to support a tooth. If you've lost one tooth, you just need one implant. If you've lost three teeth, you perhaps only need two implants. And you can still have a bridge of some sort that is fabricated onto that. Why implants have become so much more prevalent is because the traditional way, or the traditional fixed way of replacing teeth, was a bridge, where the teeth on either side of that gap had to be cut or prepared, as we call them. By an implant, we're now placing a prosthetic device in the gap without touching the adjacent teeth. Another problem with the bridge is that when there's problems to the supporting teeth, you now lose the bridge. So where a procedure was done to replace one tooth, you now have a possible problem in an area of three teeth.
Mm.
We still do bridges, not as frequently. I think we can count how many we do these days, but it's not as widely used, simply because of how invasive it is. Partial dentures are another option of replacing missing teeth, but in a patient who's missing one, two, or three teeth, which is few, having this big mass of plastic or acrylic in the mouth is difficult to adapt to. I think with that being said, we also see patients who come later in life requiring replacement of teeth, and they would say, my mom or dad wore dentures so well, I can wear dentures. What we also got to think about is that patients back in the day, or patients historically, were exposed to dentures in their teenage years. So in the same way that they would be able to start wearing dentures 13, 14, 15, they became extremely competent and functional wearing dentures in their 60s and 70s. If you have to give a 40-year-old a removed prosthetic device for the first time, it's difficult to adapt to. And that's where implants have become that way of anchorage of a replacement tooth. So you start thinking of replacement of teeth and trying to be conservative and trying to be single tooth, because now we also know that any work that is carried out, and I think this is something that a message our patients need to hear more often, is that dentistry doesn't last forever. Dentistry was not meant to last forever. And by the fact of dentistry having complications isn't a representation on the clinician's skills. Everything that we do that is man-made has a lifespan. Patients would be amenable to replacing a cell phone every 2 years or replacing a microwave every 3 years. Dentistry should not last 2 years, definitely not. I think our evidence is closer to 10 years plus. But complications are things that we have to accept. And once again, implants, I always look back and say that if a patient has to have had a complication with normal tooth-borne dentistry, they would generally be slightly worse off than when they started off. Generally, in a very loose way. With an implant world, you're back to where you are. You had no tooth, the implant had a complication of whatever nature it may be. Unlikely in a healthy patient with the right patient selection, you lose your tooth altogether, but you're back to where you are. So 10 years later, you're not worse off. And I think that's important to also think about. But when we think of all the philosophical dental terms and medical terms in replacement of these teeth, we also go back to think about that there is a cost factor that's linked to this. And whether we're living in Africa or South Africa, we're still part of a global community. And I think when I chat to colleagues who sit in Europe, the Western countries, I think the problems are the same. The currency denomination is different, but ultimately the patient in Switzerland still says, I can't afford treatment, or treatment is too expensive. So we as South Africans also shouldn't think that it's expensive because we live here. It's expensive because we're in Africa. It's expensive because it is advanced level care. It's tertiary level care. and it's a level of care that does require a high skill set. And that skill set is provided by a practitioner who had to invest beyond being a general dentist. More often than not, he's invested more than just 5 years of dental school. It's been hours of traveling and teaching and learning that goes with that. And we have to take into consideration that comes in with this. I think patients' perception of care will also come in, and where they would value oral health. And this is not, it's not a judgment on patients. Everyone's priorities and accessibilities and financial resources are different. But I do think, though, that I think I grew up in a very middle class family. And if I think of the formative years, my parents had to invest a lot into my education, my siblings' education. There was very little surplus money available for the luxuries and frills. But I do think that because something isn't financially attainable now, even though we appreciate it could be the best, it shouldn't be written off for eternity.
Yeah.
That should fit into the plan in the same way that the car, which needs to be replaced in 5 years or 6 years, is part of a plan. And we know the cell phone contract is up for due in 2 years. We should also incorporate our dental and oral health needs within that.
Yes.
Because we want to live a life that is more, not say all-inclusive, but all-encompassing. And oral health definitely, unfortunately, plays a big role into that. Yeah, so dental implants sits right in the middle of all of this. And I think it's amazing. It's amazing that we're able to now provide care, because the way the speed of care has come up, the predictability of care has become a lot safer for patients. And I think once that implant has now been delivered to the patient, or the prosthesis have been delivered, maintenance is something that patients also need to abide by. The only thing that will last in the mouth forever is a healthy tooth. That you were given twice in your life. The one was a chest one, and the second was the one that you keep. Beyond that, you're paying for it, unfortunately. You need to look after it even more. There's very little immune and biological response that's keeping an implant in the mouth. So patients can neglect, and they sometimes get forgiven for neglecting their 6-monthly recall and return after 9 months. They sometimes return after 2 years of not having a cleaning done. And in an otherwise healthy patient with a decent home care regime, the consequences are not severe. In the implant world, if you lose bone or you lose gum as a consequence of oral hygiene neglect, it's very difficult to reverse that process.
Yes.
So my strong advice to patients is not just the initial investment in treatment, but also the investment into maintenance at home, as well as seeking your oral hygienist or your dental practitioner every 6 months or 4 months, whatever the regime may be. Should patients, I think, and the last thing, patients from here hopefully would go out and look into seeking dental implants. I think seeking opinions is great. Too many opinions is not a good idea. ChatGPT and Google, not perhaps the best place, because the information comes on what you're looking for. If you're looking for yellow cars that meet in an accident, you will find many Google reviews on yellow cars that have met into an accident.
That's a great analogy.
And I think dentistry would be the same. You would find things of where patients are publishing. Patients are publishing on the internet their experiences, and their experience is their lived experience. It's not a representation of what retrospective studies tell us of certain procedures. So get opinions by practitioners who are trained, educated, and versed in the treatment planning and the treatment execution of dental implants. And you may be referred between specialities. A prosthodontist like myself, you may go to a maxillofacial surgeon. You may end up needing to be placed between multiple specialities for that implant to be placed in an environment that is ideal for its longevity. And I think it's important we look into those aspects of our care. And I think the last thing with this, and I think it's just generally becomes that white elephant in the room, is medical tourism. We get it often in our practice. Patients would say that they've heard that someone in a foreign country, certain countries quite popular, but let's just say they go overseas for their implant work. you can appreciate that it was cheaper and they wanted it and they understood the need for replacement of teeth. The challenge comes in is that when you seek such high level care, which is a dental implant overseas, and we just spoke on the maintenance and the possible complications that can happen, which can or cannot be reversed. There's one, the treatment of the complications that can be addressed early on. And there also comes the warranties and the guarantees and the sureties from that
Yes.
practitioner. When patients do travel for medical tourism, like something like a dental implant, what happens when there's complications? Patients will come back to our practice, and implant systems, I think there's close to, I don't want to throw numbers out there, but let's just say 20,000 different implant systems globally. Every implant system has a unique screwdriver, so a unique key that is able to maintain a certain implant. We don't have access to all of those. We have access, fortunately, in our country, we are extremely privileged to have access to the top 5 implant companies in the world. South Africa is incredible. I think I'm so proud to be a South African practitioner because we have access to first world care, first world equipment. And what happens to maintenance? Because we look at some of these patients and we tell them we don't have the tooling kits that are available because it's not available. Just don't do it. And if we have to look at maintaining, and while in the process of maintaining it, a screw breaks, a screw strips, replacement parts are not available. And then liability becomes on the patient's lap, because now the patient has to fly back to country X to get the work adjusted or modified. And wherever you did seek treatment, you were still a medical tourism patient.
Yes.
So whereas your practitioner who's in the suburb 2 kilometers down the road from where you live has a special attachment to you and your care and your well-being, because he not only treats you, he treats your family, he treats your colleagues and your friends. And I think that there's a lot more of an emotive contact or context to care in this regard because of that happening here. So I think it becomes a very sensitive area because we want patients to access care. We want them to get access to first world within their budgets, but we also don't want them to find themselves in a position where they've become almost held at ransom to now their dental care.
Yes.
And I think it's great. It is changing. I've had patients in our practice, and we almost see this evolution. We've had patients, we've seen them, and then they've never come back and they've gone overseas. And then we've had patients we've had this conversation with, and they've accepted treatment here, and now they've told their friends and family and said, you know what, think of it in this way. And then those that have gone overseas have now returned. And I think the tide is changing, and you've got to applaud doctors like yourself and Sada for creating this platform, because it's at times the only time that we get to engage with our audience.
People out there,
on
yes.
these topics.
Yes,
So I think in a nutshell, if we have to summarize dental implants, you gave me 15 minutes. I think that's in essence where we would look at. It's really important for your higher cognitive abilities and the functioning throughout life. It's really important through nutrition and adequate absorption of the micronutrients and macronutrients that we require, which become more demanding as we age through life. Psychosocial needs, as our patients and our friends and families age, socially, all we have to live for is our friends and family and tea parties. We need the teeth for that. In our middle-aged years, dentition is critically important for the avoidance of further complications and avoiding the other teeth from overloading and further teeth breaking down. And then obviously we spoke about the access to this care and how important it is to seek the care in the right spaces.
Yeah, absolutely. And I think also, this may sound funny, but in the age of where we are and the influencer era, it's vanity plays a huge role, I think, in
100%.
everybody's world, whether you're working from home, whether you're in an office, whether you're a stay-at-home mom or whatever it is. But the people often underestimate what effect the loss of
100%.
teeth has on the skin, sagging of the skin, the facial muscles, just general aging. It happens almost overnight and people don't realize it.
Yeah, it happens, and it's such a valid point, because when they do realize it, the return to normal the thought process is instant gratification. Let's get it fixed now.
And it doesn't
It,
happen.
it doesn't happen. And it can't happen. And I think when we start chatting to patients who've lost teeth and they realize they need bone grafting and from weird places in the mouth and the body to rebuild these areas, you start realizing that implants are necessary, but teeth are so much more important
Yeah.
in the preservation of these teeth.
Yeah.
So it's really a great concept, and I think it's something that we do need to keep engaging with. And I think we can never have too many of these conversations.
Oh,
Because at
100%.
some
Yeah.
because at every viewer at some point will listen to this, and even if we just get an individual that clicks, we know that it is a family who's now got a different message or who's now been exposed to dentistry in a different light. And I think this is very important. Yeah.
Awesome. Thank you so much. I think your insight has really been wonderful. I hope that even if we reach 10 people out there today who have listened to you and have taken something back from that, then I'd be a happy person. So
So you
thank
get a
you
bit
so
more than 10.
much.
But thank you for having me. Absolute privilege to always be here.
Thank you so much.